Thank you to the Harvard Chan School of Public Health. I am so honored by this award. And I want to start by thanking my mentor, my colleague, and my dear friend, Dr. Howard Coe, who nominated me for this award. What a remarkable gift Dr. Coe is to the Harvard School of Public Health. From his time as Commissioner of Health for the state of Massachusetts to his term as United States Assistant Secretary of Health, to his remarkable tenure here at the Harvard School of Public Health, including his life-saving current work focusing on those who are homeless, his career has been extraordinary. Dr. Coe was my chief medical resident when I was an intern at Boston City Hospital in 1981. And from that time to today, he has always supported me. Please join me in thanking Dr. Coe. I also want to take a moment and thank all of my family and friends who have joined me here tonight. So thank you all. And I want to give a special shout out to my two sweet grandsons. Joy, who's about to turn 5, and Michael, who's about to turn 7. They've been very good boys for the whole evening. Most of all, I want to thank my wife, Beth, who for almost 40 years, through thick and thin, has been the rock to which I've been safely moored. Thank you, wife. I've devoted my career to reducing the scourge of tobacco addiction on our population, with particular focus on helping those addicted to smoking to quit. And we've made substantial progress, as mentioned in the video. Over the last 6 decades, smoking rates have fallen from over 40% in the early 1960s to 10 to 12% today. A remarkable achievement, and many members of the Harvard community have contributed to that success. Some think tobacco is old news, no longer a threat. But in fact, almost 30 million Americans continue to smoke, and half of them, 15 million Americans, will die prematurely over the next few decades of an illness directly caused by their smoking. Thus, it quietly remains the chief avoidable cause of illness and death in our society. The reason that it is viewed as yesterday's news is that the people in this room and in other similar venues don't smoke. Rather, the people who are smoking are the poor, the least educated, and those with substance use and mental health diagnoses. Thus, I dedicate this award to them as we continue to fight to fully eliminate tobacco dependence from our society. And I want to end by talking just a little bit about Harvard and what it means to me. I was born and raised less than 10 miles from the Harvard School of Public Health in a part of Boston called Hyde Park. My neighborhood was made up of poor immigrants, including Irish, Greeks, and Italians. Neither my father, who came from Italy, nor my mother, who was the daughter of Italian immigrants, ever finished high school, as they worked during their teens to help support their families during the Great Depression. While not formally educated, they emphasized to us that an education would be the ticket to a life. And as a kid growing up in Hyde Park, the pinnacle of a good education was the privilege of attending Harvard University. I can't emphasize enough what an honor and privilege it was to attend Harvard. After I was admitted to the Harvard School of Public Health, my father, who was a custodian in the Boston school system, kept in his wallet my business card from Harvard, and he would also often show it to his fellow custodians with pride. Over the decades, The Harvard School of Public Health and Harvard University more broadly has made extraordinary contributions to our lives as Americans, including improvements in public health. In this time of unequal challenges to the institution, I want to proudly state that I am a graduate of Harvard, and I am so thankful that as a young boy from Hyde Park, the dream of attending this unequal institution was realized. To Dean Baccarelli, the faculty and staff of the school, and all of my fellow alumni, thank you for honoring me with the Harvard School of Public Health Alumni Award. Thank you very much.